The state of Indiana reported another record day of COVID cases as Omicron continues to spread like wildfire. And tonight, the CDC says your best bet at avoiding serious illness from this variant is getting your booster. So tonight we want to take a look at which boosters are available to Hoosiers of all ages and how many Hoosiers already have theirs across our state. But first at 11, our Lauren Kostick breaks down how much extra protection that you get once you are boosted.
As the Omicron variant continues to dominate the country, new real-life data is shining a light on ways to combat it, saying our best defense is a booster shot.
We are seeing the highest case counts for the pandemic right now.
On Friday, the CDC released 3 studies showing how booster shots work against the Omicron variant, which accounts for 99% of COVID cases in the U.S.
Good evidence that suggests there's a great reason to get your booster.
Dr. Sean Granis with the Regenstrief Institute is a co-author of one of the studies. And after reviewing millions of COVID cases, here's what they found. With Omicron, if you're boosted, you have an 82% chance of avoiding a trip to the ER after catching COVID. If you're vaccinated but don't have the booster, that protection drops to about 38%. And when it comes to being hospitalized, boosters were 90% effective at keeping people out of hospital beds. That drops to 57% for people who were vaccinated but not boosted.
We're concerned about vaccine effectiveness. We've been concerned about how well will the vaccines do against Omicron. And now we have some evidence that that booster does in fact provide very good protection.
But right now, less than half of people in the U.S. eligible for the booster actually got one. In Indiana, it's barely above 40%.
But I'm hopeful that this will encourage more Hoosiers who have completed the 2-dose series to really think about getting that booster.
Tonight, let's dig into Indiana's vaccination and booster rates and show you how we're stacking up against other states. Right now, about half of Indiana's population is fully vaccinated, so that lands us in the bottom 10 states across the nation. So think of this circle as the 3.5 million Hoosiers who are fully vaccinated. And of that group, only about 41% have their booster. So how does Indiana compare to other states? We're pretty much right in the middle. The 22 green states that you see here all have a larger percentage of people with booster shots. And these 27 blue states here have a smaller percentage. Right now, Vermont is the leader with 56% boosted.
Let's take a closer look now at who's eligible for that booster shot. And we're going to start with the 2 preferred vaccines, one from Pfizer, the other from Moderna. Pfizer's booster is the only one available for kids ages 12 to 17. You should get it 5 months after your second shot. Now, Moderna is available for anyone who's 18 and older and should also be given 5 months after the second shot. So keep in mind, you can mix and match. So for example, if you got Pfizer for the vaccine, you can get Moderna for the booster and vice versa. Now, as far as the Johnson & Johnson booster, it's only available for people who are 18 and older. That should be taken 2 months after you got that single-dose vaccine. But the CDC recommends getting the Pfizer or the Moderna booster instead.
Now, the CDC just approved booster shots for 12 to 15-year-olds a couple of weeks ago, so it's probably going to take some time to get similar approval for kids 5 to 11. Right now, kids in that age range can only get the Pfizer vaccine. The company is also working on a version of that shot for kids under the age of 5. They hope to submit their findings to the FDA in the first half of this year.